Welcome to Whiteboard. Myself Sirisha. So today we are going to discuss a topic from pharmacy, government pharmacy syllabus. So the topic is therapeutics. Okay. So the therapeutic is which includes in the unit 9. From unit 9 we are discussing one topic, that is therapeutics. Especially in therapeutics we have to discuss the pathology of blood and urine. And today we are going to discuss the pathology and different types of cells, their functions, their roles. So what are different types of diseases related to it. So everything we will discuss. Already we have studied in our lower classes, but still here we are just learning some terms related to pathology, related to diseases. So everyone knows what is RBC, what is WBC, but here we are going to discuss some diseases related to that cells. Okay. So this is from pharmacist syllabus, government pharmacist grade 2. So everyone know we have the notification recently. So the topic is from unit 9. Okay. So what we are going to discuss today? So today we will discuss introduction. First of all we will discuss introduction, okay, and then we will discuss different types of cells in blood, different types of cells in blood, different cells in blood. So what are the different types of cells that are present in the blood normally? So you will have RBC, you will have WBC, you will have platelets. So all different types of cells we will discuss, and then we will discuss pathology, means what? Different types of diseases related to that cells. Diseases means increase in cells or decrease in cells causes what type of diseases. The names of diseases is very important. What are the names of diseases? Because for competitive, the names and memorizing the definition of that terms is very important. Okay. So we will discuss that in detail, and finally we will discuss about erythrocyte sedimentation rate. So how that erythrocyte sedimentation rate takes place, we will discuss that small topic. So how normally abnormal patients, means what? The people who are having any problem, or the patients who are having any issues in the blood, or a normal healthy individual, is there any difference? How can we test that? So we are having small test, and the names of that test is also very important. Okay. So finally we will conclude the topic. Okay. We will finally conclude this topic. So these are the topics which we are going to discuss today. Okay. So coming to introduction. So the topic is pathology of blood and urine. Okay. So the term pathology, first we should know the term of pathology. Why? Because learning from the basics is very important. Directly entering into the blood, directly learning the anemia, directly learning megaloblastic anemia, it doesn't make sense. So any topic when you are reading, try to start it from the basic level. Why? Because the questions will be not so complicated as GPAT. Those questions in the government pharmacist exam are very simple, but the thing is they are conceptual questions. So learning from the basic level and having conceptual knowledge is very important. Okay. So the term pathology is derived from Greek word. Okay. So patho means what? Disease. Logy means study. So studying about the disease. What it is? Studying about the disease. Pathology means, so any pathology means what? So we are studying about the disease. We are studying what are the causes, is there any treatment, what not treatment, especially we will study how the disease is caused, what is the main reason. Okay. So that is called as pathology. So patho means disease and logy means study. Okay. So it is normally the subject pathology mainly deals with study of diseases. What are the causes? So how normally the diseases are caused. So first we have to study little bit about anatomy, and then we'll move on to pathology. Okay. So, how that diseases is caused, everything will study in detail in pathology. It is a branch of medicine, everyone knows that. And how means especially we will study about the diseases, right? Disease means what? A difference between a healthy individual. So, normally a healthy individual and an abnormal individual or a patient. So, knowing the difference is very, very important. So, that is why, so having symptom, so normally a patient will have what? He will have symptoms. Normally something won't be written on his forehead, right? So, he will get symptoms, he will get fever, he will get cold, he will get chills. So, all these symptoms together we have to study in one subject especially. So, that diseases causes, some X disease causes some fever, chills, some other diseases causes some pains, some other diseases causes some joint pains, some other disease causes vomitings. Means what? First we have to study about the diseases, then only we can understand how we can treat those diseases. Okay. So, that is the importance of pathology. Okay. So, what we will study normally, the diseases are because the diseases may be because of so many reasons. That may be due to abnormal genes, that may be due to chromosomal aberrations to cause diseases, mechanical injuries or radiations or chemicals, cancer, etc. So many. So, because of radiation some changes will be there in your body, or because of some bacterial infection. So, whatever the reason. So, what is the reason? How the disease is caused? What are the symptoms? What is going on when the patient is suffering with the disease? That we will study. Okay. So, today we are going to study about blood, as already told you. So, blood consists of plasma. So, normally you will have plasma, that is nothing but serum, and you are also having, that is liquid component of the blood. Then what are the cells that are present in the blood? So, what are different types of cells in blood normally? So, we are having 3 types of cells especially, that is RBC, WBC, platelets. So, we will study in detail about these 3. Okay. So, coming to blood, it is a connective tissue. Normally it will be connecting each and every organ. It is a circulatory system, right? So, blood is a thing which is carrying oxygen and transporting carbon dioxide out of your body, right? So, it is carrying oxygen to your body parts and carrying carbon dioxide away from your body. So, that is very, very important work, one work that is done by blood. Not only that, it also done so many works. We will see what normally the blood will do in our body. Okay. So, it is a closed system. Yes. So, blood is fluid in nature. So, it is a closed system. So, total volume, this is very, very important. Some basic points they will ask, like normal glucose level is how much? Normally, how much human blood, means what is the approximate volume of human blood? So, normal questions, normally a healthy individual will have 5.5 to 6 liters of blood. And what is the pH of blood? This is very, very important. So many times it was asked in different types of entrance exam, and one of the previous year GPAT question as well. What is the pH of blood? Not only pH of the blood, you have to study pH of all your body fluids, like what? Tears, you have to study about the tears. Urine, you have to study about gastric pH. So, when you are seriously preparing for the government pharmacist exam, try to write a note of all these pHs at one page. Okay, write it on a page so that you can memorize all that pHs. Okay, that is very, very important. This is one of the question framing type of question. Means what? Normally from all these topic, which point will be framed as a question? That point you have to understand. So, what can be framed as a question? Very simple, a number can be framed as a question. So, they will give you different numbers and they will ask you the pH of blood. So, not only pH of the blood, learn the pH of all different body fluids. Okay. So, that is pH of the blood, it is slightly alkaline, it is 7.4. So, coming to, I told you 3 types, I already told you. So, RBC is also called as erythrocytes, right? And RBC is more in number. Normally RBC is so high in your body, RBC is increased number. Normally RBC is high and WBC is less in number, and platelets is also, it is a cellular fraction of the blood. Okay, it is nothing but its work is to clot when there is an injury, when there is a hemorrhage. So at a cellular fraction of your body, it comes into the scenario when there is an injury, when there is anything, then only it will do work. If not, it is not having any work. So RBC, it is continuously, it is having work. It will carry oxygen, it will transport carbon dioxide, so to the lungs. Normally filtration, that is nothing but impure blood, pure blood conversion is especially based on your red blood cells. So those are the three types of the cells. So in this topic, learning about the normal ranges is very, very important. Why? Because if you know what is a normal range, so whenever you went to any lab, if you have any blood test or urine test, normally the lab report will have standard value. So first, if you observe any report, normally you will have standard values, and then you will have your values, test values. So they'll compare. So this is the standard value, whether it is increased or decreased. So suppose this is some number, 5,000 number. So if it is 8,000, that means the person is having increased number of that cells. So that means what? Learning standard values is also very, very important as a pharmacist. So when you are preparing to the pharmacist, think that what are the points that a pharmacist should know. So is there any necessary of learning all this? Yes, it is having some beneficiary effects when you are doing your pharmacist job. So directly learning this, memorizing this is very, very important. So coming to RBC, so in men 4.5 to 6.5 million per mm cube is the normal ranges. Okay, it is in a healthy individual range. In female, 4 to 5.5 million per mm cube of RBC, red blood cell count will be there. Okay, so below that or above that will cause some abnormal diseases. Okay, so coming to the WBC, I told you already, this is in millions, right, per mm cube. This is also per mm cube, but the thing is the number is very less, only 5,000 to 10,000. The number is very, very less. So coming to the platelets, it is 0.15 to 0.4 million per mm cube. Okay, it is also very less in number compared to this. Compared to RBC, it is less in number. So first you are having more RBC, and then you are having platelets, and then you are having WBC. Coming to WBCs, so WBCs are of how many types? So remember, once again I am telling, RBC in millions, 4.5 to 5.5 or 6.5, and WBC 5,000 to 10,000, and platelets 0.15 to 0.4 million per mm cube. Coming to WBC, in the basic level we know that WBCs are of two types, granulocytes, agranulocytes. Okay, so granulocytes are nothing but, that is neutrophils, eosinophils, basophils. Okay, so neutrophils are 40 to 70%. So most of the cells, out of all the cells, most circulated cells, okay, most circulated cells are neutrophils. In the blood, the most circulated cells, WBC, when you are comparing it with WBC, out of all leukocytes, out of all WBC cells, this neutrophils will be more. Okay, and eosinophils are very less, 1 to 4%, and basophils 1%, nearly 0 to 1%. So coming to next type of cells, that is agranulocytes. So agranulocytes are of lymphocytes, monocytes. Okay, two types. Agranulocytes are of two types, that is lymphocytes and monocytes. Okay, so lymphocytes are nothing but, normally lymphocytes are converted into two type of cells. What are those cells? B cells and T cells. B cells and T cells. Okay, so agranulocytes are nothing but, those are lymphocytes, and monocytes will be nothing but, monocytes are nothing but they are antigen presenting cells. So what is antigen presenting cells? That you will clearly understand if you study about the immunity. So connecting the subjects is also very, very important when you are preparing for the exam. So you have to connect the subjects. So you will come across this topic in ecology. You will come across this topic in immunity as well, because we are learning about WBC cells there. Okay. So monocytes, most of the monocytes are converted into antigen presenting cells when you are having an infection. So cells like what? So monocytes are nothing but antigen presenting cells. So abnormal components of any constituents of blood leads to disorders. So having any increase or decrease of the standard values will leads to a disease. Okay. So increased or decreased levels of any of this number will leads to abnormal condition. So that is nothing but disease. So that abnormal diseases will study in detail, and very, very important for your competitive. So what are the functions of the blood? So you know very well, normal general points it is. So that is transport of oxygen and nutrients, and transport of waste materials. Waste materials are also transported. Yes. So transport of waste materials. So carbon dioxide is transported away from the organs by the blood. Okay, and carries hormones. So hormones means what? Normally hormones are released at one area and they are carried into the blood, and it was reached to its target area. Okay, so that is hormones are also circulated. Not only hormones, water is also distributed in blood and contains WBC. It also having WBC, it also having platelets, different type of clotting factors. So WBC is essential for producing or causing, protecting the body. That is nothing but immunity. Immunity is immunity can be seen because of this WBC cells, and different types of clotting factors and platelets, they are responsible for clotting of your blood when you are having any injury inside the body or outside the body, whatever it is, but normally the clotting factors will come into the scenario. So this is about the functions of blood, general points, but these are just knowing the points but not a frameable questions. So this from here, so erythrocytes, so normally we have to know, we have to see some basics of erythrocytes because we don't know how the question will be. So we will learn some important points about the erythrocytes. So erythrocytes are nothing but, so you know normally erythrocytes will be having some biconcave shape. So they don't have any nucleus, they are without nucleus, very, very important, and the size of the cell is 8 microns, 8 microns. Okay. So these cells are having cytoplasm in them, they are having cytoplasm in them. They are also having some red color pigment that is called as hemoglobin. So that hemoglobin is responsible for red color in the cells, that is also present in the cytoplasm. And RBCs are produced by whom? This is very, very important. RBCs are produced from which part of your body? So you will have so many options, but the thing is 3 are there, 3 things will be producing. What are they? Bone marrow, spleen and kidney. 3 are involved in production of RBC, not only bone marrow but also spleen and kidney. Okay. So lifespan about 120 days, normal lifespan is 120 days. So after 120 days it has to die, it has to destroy, right? So where it is destroyed? It is destroyed in liver and spleen. It is destroyed in liver and spleen. It transports oxygen and carbon dioxide, that is a general point, already we know that. Okay, that is general function of RBCs in the body, carrying oxygen and carbon dioxide. Oxygen into the body, carbon dioxide out of the body. So now coming to very, very important topics of RBC. So the diseases of RBC is very, very important. Just now we have seen the introduction part. Now entering into deep of your subject, that is anemia. Anemia is nothing but it is a condition in which oxygen carrying capacity of the blood is reduced, means oxygen carrying capacity is reduced. Oxygen carrying capacity means who will carry oxygen normally? RBC cells. That means reduction of RBCs or reducing or decrease amount of hemoglobin, anything is same. So that condition is called as anemia. So that means decrease in number of RBCs or decreased concentration of hemoglobin. So that condition is called as anemia. Coming to symptoms, fatigue means tiredness. The person will be so tired, okay, and intolerance to cold, and breathlessness and loss of appetite. So he will have some breathing problem, he will have some he can't eat food, so he can't eat properly, so loss of appetite and loss of so he'll have some difficulty in breathing as well. So he will have cold, intolerance to cold. So all these symptoms can be seen when the person is having anemia. Okay, so anemia is nowadays, it's so common. So the people are, especially women, are suffering with this disease normally. So there is a more scope. Normally the questions will be framed from current topics. So currently the world or the crisis of health means what are the problems that are related to health nowadays, especially related to virus. We have seen COVID-19. So that is expected question. Regarding vaccines, expected question. And regarding anemia, diabetes and hypertension, these all are expected type of questions. So the examiner will focus on current healthcare systems. Okay, so try to focus more on the current type of situations that going on in the society. So that type of topics are normally chosen. So this is anemia. So we have seen so many types of anemias are there. Okay, so we have to see all these anemias, very important. So what do you mean by pernicious anemia? So we are having different types of anemias. Anemias like what? Pernicious anemia, microcytic anemia, macrocytic anemia. So many types of anemias are there. In that, what is pernicious anemia? So pernicious anemia is nothing but, so whenever vitamin B12 is present in your body, yes, vitamin B12 will be entered through food or diet, whatever it is, vitamin B12 is entered into my body. What you have to do? You have to absorb that vitamin B12 from your GIT. So to absorb that, we need one factor, very important. So normally vitamin B12 is entered through diet into my body. It has to absorb, it should be absorbed into the blood. So this is blood, absorption into the blood, it should enter into the blood. So to do that, normally we need a factor. What is that factor called as? Intrinsic factor. What is that factor called as? Intrinsic factor. Okay, so that intrinsic factor is essential to absorb vitamin B12. Okay, but that intrinsic factor is very less, so that you don't have proper absorption of vitamin B12, such that vitamin B12 will be eliminated from your body. It is not absorbed, your body can't use that vitamin B12, so it is eliminated from your body. So that means what? You will have deficiency of vitamin B12. Okay, so pernicious anemia means what? Stomach will produce intrinsic factor, especially your GIT will produce GIT cells. Okay, stomach cells, specific type of cells will produce the intrinsic factor. So that intrinsic factor is essential for absorbing vitamin B12 into the blood. But unfortunately, that factor is not produced in these type of patients. So inability of the stomach to produce that factor, so you don't have proper absorption of the vitamin B12, so it gets eliminated from your body. Even though you are eating so much vitamin tablets, even though you are taking so much leafy vegetables, whatever, but still you are with a deficit of vitamin B12, because you don't have proper, you don't have the actual thing that is needed to absorb the vitamin B12. Okay, leads to insufficient hemopoiesis, and that condition is called as pernicious anemia. That condition is called as pernicious anemia. So what are the symptoms of this pernicious anemia? So person will become so weak, weakness, bleeding gums, jaundice, loss of appetite. Okay, so weakness, bleeding gums, jaundice and loss of appetite are symptoms of pernicious anemia. I think you are clear with pernicious anemia. So now we are going to see sickle cell anemia. Sickle cell, sick means what? Having the person is having some health issue. So sick means what? The cell is in not proper condition. The cell is having some problem. The cell is having some health issue. So this is normal RBC. This is my sickle cell RBC. That means what? The cell is not in proper shape. Okay, it is not in biconcave shape. Okay, so it is also called as hemoglobinopathy or hemolytic anemia. Okay, so abnormal formation of RBC. So RBC will be either it will be S shape or it will be C shape. So that type of RBC cells are called as sickle cell anemia. S shaped are sensitive to lower oxygen supply. So you may ask me, so whatever it is, we are having S, no, but this S or this C shape, these sickle cells are unable to supply oxygen that is essential to your body. So it is not meeting the requirements. So that means what? Suppose normal RBC will do 80% work. So this is doing only 40% work. So that means you will get some issues, health issues. Definitely that leads, if you have insufficient oxygen in your body, definitely you will have some health issues. So that means it is a problem, right? So having proper shape is also very, very excuse me, important. Okay. So S shape are sensitive to lower oxygen supply. So C shaped is also having lowered oxygen supply. So that's why having proper RBCs or proper shape to RBCs is also very, very important in supplying oxygen. So these type of cells are called as sickle cell anemia. So this cells does not pass through small blood capillaries and block the blood supply. So if you see, this is the small blood vessel. This is a small blood vessel. Okay. So if you see, this is the normal blood cells. But what that sickle cell will do, they will try to accumulate at particular point. So they cannot pass because all will be the shapes are so convenient to form a precipitate like thing. So because of that reason, all will be stuck. So because of that reason, you don't have proper movement of blood. So you will have some problem in movement of blood cells. So that is also seen because of this sickle cells. So sickle cell anemia means normally it is, sickle cell anemia means what? Cell is very sick. The shape of the RBCs will be different in some patients. Either S or C shaped cells are seen. They are responsible for decreased oxygen levels. So because of that reason, having proper RBC is also very, very important. So treating this condition is also very, very essential. Okay. So that is about the sickle cell anemia. So coming to next type of anemia, that is megaloblastic anemia. So what is this type of anemia? Megaloblastic. The name itself is saying what? Mega. Mega means big. The cell will become little bit big. That's why normally megaloblastic anemia. Okay. So megaloblastic anemia, it is nothing but improper intake of vitamin B12. So there in pernicious anemia is also a condition where you will having deficiency of vitamin B12, but there you are having deficiency not through diet, it is through intrinsic factor. Here it is caused due to inadequate intake of vitamin B12 or folic acid. So if you are not taking proper diet from the external source, so then that leads to a condition called as megaloblastic anemia. So the red bone marrow produce large RBC cells. So because of that reason, you will have large cells. I told you the bone marrow will produce large cells. So that leads to compensate the hemoglobin. Normally that is produced like that. But that is also that is caused due to treatment of cancer. So especially in treating cancer, this type of condition is common. So the people who are getting treated with the cancer, so for them you will have side effect as megaloblastic anemia. Okay. So it is nothing but, in simple I will tell you, megaloblastic anemia is nothing but deficiency of vitamin B12. the size of the RBC is very big because RBC is producing very big RBCs. So that type of condition is called as megaloblastic anemia. It is also a side effect of cancer treatment. Okay. So this is about megaloblastic anemia. So coming to next one, that is iron deficiency anemia. So this is caused by inadequate absorption of iron. Iron is not absorbed completely. So iron, even though you are taking proper diet, everything, but still you are not having proper absorption of iron. Okay. So excessive loss of iron is seen, and sometimes you don't have proper absorption and the person is not taking iron properly. So he is not taking the daily requirement of iron as well. So the most common type of anemia, that's why the government will produce in healthcare centers, the government will provide in villages etc. iron tablets it's a common thing nowadays the government is providing, because this is the most common type of disease that can be seen in especially in women. Okay. So women are at high risk for this type of disease because of menstrual blood loss, okay, and increased iron demand during the pregnancy. Yes, during the pregnancy also you need more amount of iron. So because of these menstruation etc., this pregnancy all are seen in women. So women are more prone to iron deficiency anemia. So the women are given iron tablets at most priority. So what is the symptoms of iron deficiency? So the symptoms of how can you identify or how can you see whether you are having this iron deficiency or not? So that is nothing but headache, okay, and pale skin, dizziness means headache and you will have vertigo like thing, leg cramps, pain of legs, you will have pains, heart palpitations, okay, irregular heartbeat, slow blood loss and brittle nails are the common symptoms that are seen in iron deficiency. So coming to aplastic anemia. Aplastic anemia is a condition where you will have destruction of, aplastic anemia is a condition where you will have destruction of red bone marrow. Destruction of red bone marrow. So red bone marrow itself, so the source of RBC is also damaged here. The source of RBC, that is nothing but bone marrow. So bone marrow itself get damaged here. So that condition is called as, so because of that reason RBCs are not produced up to the mark. So because of that reason you will have anemia. So anything is anemia, but the reasons are different. Some is due to improper absorption of intrinsic factor, some is due to deficiency of intrinsic factor, some is due to improper absorption of iron, some is due to diet. So everything is anemia, but the reason for that anemia is very, very important for your competitive exam. So what is pernicious anemia, what is megaloblastic anemia, so the names, what is the reason exactly, that is very, very important. So aplastic anemia means what? Destruction of bone marrow, so that leads to a condition called as aplastic anemia. So that is mainly, that is not commonly seen, it is especially seen in rare conditions. So when a person is exposed to gamma radiations, when a person is exposed to gamma radiations, toxins and medication that inhibit the enzymes that are required for hemopoiesis. So in that, so especially when the person is exposed to gamma radiations, toxic substances, toxic environment, so then he will have the bone marrow destruction. So that leads to a condition called as aplastic anemia. So what is hemorrhage anemia? Hemorrhage means what? Hemorrhage anemia is nothing but you will have bleeding. So bleeding that may be due to wounds, that may be due to accidents, whatever it is, that may be due to surgeries at the time if you are not controlling properly, that may be due to menstruation etc. So if you are having heavy loss of blood due to injuries in the body, especially not menstruation. So especially due to injuries, accidents during during surgeries, etc. So that condition is called as hemorrhage. Okay. So that is called as hemorrhage anemia. So hemolytic anemia, lytic means what? The name itself is saying lytic. Lytic or lysis means what? Breakdown, right? Breakdown. So here what is breakdown? RBC is breakdown. RBC means complete RBC is not broken. Only the plasma membrane of that RBC is broken such that the contents of the RBC will be going out and the cells will be destroyed. So, hemolytic anemia means what? Plasma membrane will be ruptured. Rupture of plasma membrane will take place, especially RBC cells, plasma membrane is ruptured. Due to that, the cells will be destroyed. Okay. So, this leads to damage of kidney because the loss of these cells, the broken parts of these cells will be becoming a burden. The cell size will be the proteins or the cell particles. So, that will create burden on your glomerulus. So, because of that reason it cannot filter the heavy particles. So, the load will be created on your glomerulus. So, that is how your kidney damage or kidney failure, glomerulus damage will be seen. So, that is called as hemolytic anemia. So, coming to macrocytic anemia, so it is nothing but macrocytic anemia is also called as, it may be two types. Macrocytic means cell size will be increased. So, that cell size, increase in cell size, that can be seen in two conditions. One is pernicious anemia, one is megaloblastic anemia. Megaloblastic anemia is also deficiency of vitamin B12. Pernicious anemia is also deficiency of vitamin B12, but here pernicious anemia is especially due to deficiency of intrinsic factor. So, intrinsic factor deficiency is seen. So, because of that you will have deficiency of, you do not have proper absorption of vitamin B12. So, you will have deficiency of vitamin B12. Megaloblastic anemia means you are not taking proper vitamin B12 and folic acid. So, that is why you are getting your cell size is increased. So, that condition is called as megaloblastic anemia. So, deficiency of vitamin B12 or folic acid and RBC size is very large with low hemoglobin content. So, that is called as macrocytic anemia. What is microcytic anemia? The name itself is saying macro means big, micro means small. RBC size is reduced. Why is the size is reduced? So, whenever you are having iron deficiency, so in that condition normally you will have this microcytic anemia. Means what? RBC size will be reduced. So, that condition is called as microcytic anemia. So, coming to hemolytic anemia, just now I told you. So, these are the terms in simple to remember in one word I have included this. So, this is hemolytic anemia means just now I told you breakdown of the cell membrane, especially plasma membrane. So, that is nothing but destructions of RBC. In simple, RBC get destroyed. So, the destruction or the breakdown of the plasma membrane, who will do that? Especially bacteria will do that. Bacteria will cause damage to RBC cells. So, that means what? In bacterial infection like malaria, snake bite, etc., you will have this hemolytic anemia. So, very important, macrocytic anemia, so people will confuse macrocytic, megaloblastic, pernicious, all are same, cell size is increased, but what is the difference? Normally macro means increase in size, that is seen in two conditions, pernicious and megaloblastic. Pernicious means especially deficiency of intrinsic factor, that leads to deficiency of vitamin B12. Megaloblastic anemia means increase in cell size, that is okay. At the same time, deficiency of vitamin B12 or folic acid through diet, that is called as megaloblastic anemia. Macrocytic anemia means deficiency of iron. Aplastic anemia, so just now I told you aplastic means bone marrow damage, especially due to gamma radiations, you will have that. So, that type of anemia is called as aplastic anemia. Sickle cell means cell shape will be varied, especially S shape, C shape. So, because of that you do not have proper or sufficient oxygen supply to your body parts. So, that condition is called as sickle cell anemia. So beta thalassemia. So what is beta thalassemia condition? So beta thalassemia is a condition where you will have you will have the RBCs, but you will have immature nucleated RBC. I told you RBCs are non-nucleated. You don't have any nucleus in the RBCs. But here you are having immature nucleated RBCs. Okay. So that RBCs are present, extremely thin and fragile. So this is a hereditary disorder. So having nucleated RBCs is a condition which is seen in which of the following disease? Nucleated RBCs, it is a condition of anemia, is seen in which of the following blood disorders? So that is nothing but beta thalassemia, in which you will have immature nucleated RBCs. It is a hereditary disorder. Okay. So what is polycythemia? Polycythemia is a condition where just now I told you always what I told you, decrease in RBC, decrease in hemoglobin, decrease in iron. So abnormality means it is only deficiency? No, increase in the cell number is also an abnormality. Okay. So that means poly means what? So many, more. So polycythemia means what? It is an increase in number of RBCs. Polycythemia means what? Increase in number of RBC cells in the body. Increase in number of cells in the body. That is polycythemia. So polycythemia, that is nothing but increase in blood. Okay, the concentration of the blood is increased. So increase in hemoglobin level. Hemoglobin is increased so much in this. So that condition, so if RBCs are increased, the RBC cytoplasm itself having this erythropoietin or hemoglobin. So that means what? Hemoglobin concentration is also increased. So that condition is called as polycythemia. So polycythemia, relative polycythemia, increased concentration of RBC cells, especially due to decreased plasma volume. So normally polycythemias are of two types. Polycythemia, increase in the cells, will be because of two conditions. So I will tell you what are those conditions with a flow chart. So this is polycythemias may be of two types. Okay. So yes. So polycythemias of how many types? Two types. So that is relative polycythemia and absolute polycythemia. What it is? Relative or absolute polycythemia. Okay. So relative polycythemia means what? So whenever your blood is having liquid component, that is nothing but that is your plasma. Okay. Watery content is there in the blood. So if you are losing that content, plasma or watery content from your body because of dehydration, because of vomiting, because of diarrhea. So any of these reasons, so you will have decrease in plasma concentration. If liquid is lost from your, so normally you are having plasma as well as red blood cells. So if you are having very less amount of plasma, so this is the condition. So if you are having very less amount of plasma, okay, so that means what? Yes. So you are having very less amount of plasma. In that condition, what is increased? Your red blood cells are more. Your red blood cells are dominating. So that condition is called as relative polycythemia. So here plasma is lost from the body or watery content is lost from the blood is due to, that is, dehydration, diarrhea, vomiting. Okay. So coming to next one, what it is? Absolute polycythemia. What is the next one? Absolute polycythemia. Absolute polycythemia means what? All these are what? Bits of what is absolute polycythemia. So everyone will be aware of polycythemia, but only less people will be knowing what is absolute polycythemia, what is relative polycythemia. So knowing in deep about the concepts is very, very important to crack the exam. So number of RBCs is greatly increased in, so increase in RBC is common, but here due to loss of plasma or watery content, but here due to increased secretion of erythropoietin, Due to increased secretion of erythropoietin, you are having increase in RBC. So, due to that you are having increase in RBC. Here also you are having increase in RBC, but due to decrease in plasma. But here it is increase in RBC, especially due to increase in erythropoietin secretion. Okay. So, this is the difference between polycythemias. So, two types of polycythemias are there. What are they? Relative polycythemia and absolute polycythemia. So, polycythemias, so that is decreased plasma volume. So, that is relative polycythemia, and absolute polycythemia, increased secretion of erythropoietin. So, coming to erythrocyte sedimentation rate. So, what is erythrocyte sedimentation rate? So this is simple test to make the difference between a healthy individual or a patient or an abnormal individual. So, that means how can I make the difference? You have to collect the blood of the healthy individual, two individuals. So, who is healthy, who is unhealthy, we can just tell them by seeing the blood, by absorbing the blood for some time. Okay. So, how that is possible, that we will see in this erythrocyte sedimentation rate to know. So, it is a blood test. So, that is mainly to measure how quickly erythrocyte will settle at the bottom. So, erythrocytes are nothing but RBC cells. So, they will try to settle at the bottom, right. So, how much time that is taking to settle them at the bottom? If they are settling so fastly, immediately, so within 1 minute they get settled, for example within 10 minutes they get settled. So, that means what? The person is not that much healthy, he is having some inflammations or some infections, etc. But if the person another person's blood is settling slowly, very slowly, that means what? All the blood cells are in circulating motion. So, they are healthy. So, that means what? They are not settling, they are so active, they are not easily, they are not settling down. So, it takes time to settle them. So, that means what? Based on settling time. So, if it is so fast, he is unhealthy. If it is very fast, he is healthy. So, based on this simple concept, we have seen, found this test that is called as erythrocyte sedimentation rate. Okay. ESR. So, normally RBC will settle slowly, okay, but the faster than the normal rate, if it is very fast, suppose it takes 1 hour, normally it is 1 hour. For example, if a person blood is settling at 30 minutes, that means what? He is having some problem, okay, especially he is having some inflammations in the body. He is having some inflammations in his body, some allergic reactions are there in his body. Okay. So, normal ESR is by, so very important, these 2 points are so important. So, try to remember this, names of this, what is this? Westergren's test, yes. So, Westergren's test method or Westergren's method or Winthrop's method. So, normal ESR by Westergren's method. So, what is Westergren's method? So, Westergren's method is related to which of the following cells? RBC, WBC, platelets. It is related to RBC. So, that simple point you will come to know if you study. If you won't study, you don't know what is Westergren's test. So, that is the logic between the studying people and so who are not preparing and who are preparing. So, preparing people should aware of all the terms, all the basic concepts. It is not so hard but simple, but the thing is you have to read it, you have to study it. That is very important. So, normal ESR by Westergren's method. So, for men it is 3 to 5 mm per hour. So, the settling, so how much it is settled? So, that is normally 3 to 5 mm per hour, and for women it is 4 to 7 mm per hour. For women it is little bit high, that is 4 to 7 mm per hour. Okay. So, normal ESR by Winthrop's method. So, that is for men it is 0.90 to 9 mm per hour, and for women it is 0 to 20 mm/hour. So no need to remember the numbers. So it is little bit difficult, but having an idea about the names or the test. So what is ESR? What are the tests that are used to measure them? Normally it is related to sedimentation. So what is the normal ranges between the women? So 4 to 5 in 4 to 7 in women and children in Western Green's method, whereas in Winthrop's method is 0 to 20 mm/hour. So that is the difference. So knowing about the names of this test is also very important. So increased ESR, so you will see, so those are the normal standard values just now we have seen in Westergren's test and Winthrop's method. And if increased or decreased number of that, suppose 1 hour, it takes 2 hours. So increased number, if a person is having, normally it is in men, in Winthrop's method in men, what is the time? It is 4 to 7, okay, in women it is 4 to 7 mm/hour. So if it is less than that, for means what, if it is only 1 mm, if it is only 1 mm or 2 mm/hour, that indicates what, or once again, yes. So to settle the same amount, if a person is taking 2 hours, that means what, increased ESR. To settle the same amount, if a person is taking 2 hours than the normal range, that is nothing but increased ESR. So that is especially seen in pregnancy, menstruation, rheumatic fever, tuberculosis, anemia, certain drugs and cancers. And decreased ESR means decrease at the standard values. So the decreased ESR is generally seen in congestive heart failure and polycythemia. So decreased ESR is seen in this type of conditions. So especially, so increased ESR is seen in which conditions and decreased ESR is seen in which conditions, that is important. So decreased ESR is seen in especially in which conditions? Conditions like congestive heart failure, polycythemia. Increased, that is seen in pregnancy, menstruation, rheumatic fever, tuberculosis, anemia and some certain cancer drugs when a person is using certain cancer drugs. So this is about the complete information about your RBCs, okay. So erythrocytes, RBCs, so everything. So the complete information about the RBCs. So once again I just want to conclude the topic. So that is, today we have discussed about the RBCs. So RBCs are nothing but they are concave shaped, the time period or the 120 days is the time where they live, okay. They will normally produced in bone marrow, kidney, spleen and they are destroyed in liver and spleen, okay. So that is general information about the RBCs, and knowing about the terms is very important. So starting with macrocytic anemia, in which you will study about pernicious anemia as well as you will study about megaloblastic anemia. Macrocytic anemia is nothing but that is deficiency of iron, okay, and hemolytic anemia is nothing but breakdown of your cell membrane that leads to destruction of RBC cells. And next one, so those are certain types of anemias, and knowing about beta thalassemia is also very important. So beta thalassemia is a condition where the person will have immature nucleated RBCs, that is a hereditary disorder, okay. And you will have aplastic anemia, that means what, destructions of bone marrow. So and you will have polycythemias. Polycythemias are increased number of RBCs, that is of two types, that is relative polycythemia and absolute polycythemia. And then we have seen ESR, erythrocyte sedimentation rate. So in that we are having two tests. What are those? Westergren's test and Winthrop's method. Learning, you can memorize that, those are simple numbers, you just memorize that values, because increased or decreased numbers can be seen. So increased will leads to pregnancy, menstruation, rheumatic fever, okay, and decreased ESR will leads to, that can be seen in congestive heart failure and polycythemia. So this is about the pathology of blood, especially we have dealt today we have deal about the RBCs. We have done with RBCs. Okay. Thank you.